7 Dangerous Headache Warning Signs You Must Never Ignore. Welcome to our medical information channel. Today we will take a comprehensive and potentially life-saving look at the 7 dangerous warning signs of headaches that you should never ignore. Headaches are one of the most common health complaints worldwide, affecting billions of people, and most of the time they are harmless and resolve on their own. However, certain types of headaches can be serious warning signals of underlying neurological or vascular conditions that require immediate medical attention. Understanding the difference between a normal tension headache and a dangerous one could literally save your life or the life of someone you love. We will cover the key warning signs, their causes, how they are diagnosed, and what you should do when you experience them. Please watch until the end for the most complete and potentially life-saving information. Warning Sign 1: Thunderclap Headache. A thunderclap headache is one of the most alarming and medically significant types of headache you can experience, and it demands immediate emergency medical attention without any delay. This type of headache is characterized by an extremely severe pain that reaches its maximum intensity within 60 seconds or less, often described by patients as the worst headache of their entire life. It is most commonly associated with a subarachnoid hemorrhage, which is bleeding in the space surrounding the brain caused by a ruptured cerebral aneurysm, a condition that is life-threatening if not treated within hours. Other serious causes include cerebral venous thrombosis, reversible cerebral vasoconstriction syndrome, and hypertensive emergency, all of which require urgent diagnostic workup and treatment. If you or anyone around you suddenly develops this type of explosive headache, do not wait to see if it improves on its own. Call emergency services immediately and get to the nearest emergency room as fast as possible, because every minute counts in these situations. Warning Sign 2: Headache with neurological symptoms. When a headache is accompanied by neurological symptoms, it transforms from a common complaint into a potential medical emergency that requires immediate evaluation. These neurological warning signs include sudden vision changes or vision loss, slurred or confused speech, weakness or numbness in the face, arms, or legs particularly on one side of the body, difficulty walking or loss of balance, and sudden confusion or altered consciousness. These symptoms together with headache can indicate a stroke, which occurs when blood supply to part of the brain is cut off or when a blood vessel ruptures inside the brain, causing rapid brain cell death. Transient ischemic attacks, sometimes called mini-strokes, can also present this way and are strong predictors of a full stroke occurring within days. Brain tumors, whether primary or metastatic, can also cause headaches combined with progressive neurological deficits as they grow and press on brain tissue. The FAST acronym, which stands for face drooping, arm weakness, speech difficulty, and time to call emergency services, is a helpful tool for recognizing stroke symptoms quickly. Warning Sign 3: Headache with fever and stiff neck. The combination of severe headache, high fever, and neck stiffness forms the classic triad of meningitis, which is an inflammation of the membranes surrounding the brain and spinal cord and represents a true medical emergency. Bacterial meningitis in particular is an extremely dangerous and rapidly progressive infection that can cause death within 24 hours if not treated promptly with intravenous antibiotics, making early recognition absolutely critical. Additional symptoms that commonly accompany this triad include severe sensitivity to light, known as photophobia, sensitivity to sound called phonophobia, nausea and vomiting, and in advanced cases, seizures or loss of consciousness. One particularly alarming sign to watch for is a non-blanching purplish or reddish skin rash, which can indicate meningococcal septicemia, a severe blood infection that can cause organ failure and death extremely rapidly. Viral meningitis is generally less severe but still requires prompt medical evaluation to distinguish it from the bacterial form, which requires entirely different and urgent treatment. If you notice any combination of these symptoms, especially in children or young adults who are more commonly affected, treat it as an emergency and seek care immediately. Warning Sign 4: Progressively worsening headache. A headache that gradually increases in frequency, duration, or intensity over days, weeks, or months should never be dismissed as a simple tension headache, as it may indicate a serious underlying condition affecting the brain. Brain tumors, both benign and malignant, can cause progressively worsening headaches as they grow and increase pressure inside the skull, a condition known as raised intracranial pressure or intracranial hypertension. Subdural hematomas, which are collections of blood between the brain and its outer covering often following a head injury that may have seemed minor at the time, can also cause gradually escalating headache as the blood collection expands. Characteristic features that suggest elevated intracranial pressure include headaches that are worst in the morning upon waking, headaches that are worsened by coughing, sneezing, bending forward, or physical exertion, and headaches that are accompanied by nausea and projectile vomiting without preceding nausea. Idiopathic intracranial hypertension, formerly known as pseudotumor cerebri, is another condition causing progressive headaches, particularly common in overweight young women, and can lead to permanent vision loss if untreated. Any headache pattern that is clearly changing or worsening over time warrants thorough neurological investigation, including brain imaging. Warning sign 5: Headache in immunocompromised or cancer patients. People with weakened immune systems represent a special high-risk population in whom new or worsening headaches must be evaluated urgently and comprehensively, as the potential causes are far more numerous and dangerous than in the general population. Individuals living with HIV/AIDS, those undergoing chemotherapy, organ transplant recipients on long-term immunosuppressive medications, and patients receiving biologic therapies are all at significantly elevated risk for opportunistic central nervous system infections. Cryptococcal meningitis, caused by a fungal organism, is a leading cause of death in HIV-positive individuals and presents with often subtle headache, fever, and neck stiffness that can be mistaken for tension headache in early stages. Toxoplasma brain abscesses, progressive multifocal leukoencephalopathy, and cytomegalovirus encephalitis are other serious infections that can cause headache in this population. For cancer patients, brain metastases from primary tumors in the lung, breast, kidney, colon, or melanoma can cause new or progressive headaches and require immediate imaging to guide treatment decisions. The diagnostic threshold for ordering imaging and performing lumbar puncture should be significantly lower in immunocompromised patients compared to the general population. Warning sign 6: New headache after age 50. The development of a new type of headache in a person over the age of 50 who has not previously suffered from headaches is a significant red flag that demands thorough medical investigation without delay. As people age, the likelihood that a new headache represents a serious underlying pathology increases substantially compared to younger age groups, where primary headache disorders like migraines and tension headaches are far more common. Giant cell arteritis, also known as temporal arteritis, is an inflammatory condition of the blood vessels that almost exclusively affects people over 50 and can cause severe headache, scalp tenderness, jaw pain when chewing called jaw claudication, and most critically, sudden permanent blindness if the ophthalmic artery becomes involved. The erythrocyte sedimentation rate and C-reactive protein are blood tests that are typically markedly elevated in this condition, and immediate treatment with high-dose corticosteroids is required to prevent vision loss once the diagnosis is suspected. The risk of both ischemic stroke and brain tumors also increases with advancing age, making new headaches in older adults more likely to have serious causes compared to the same symptom in younger people. Any person over 50 experiencing their first-ever headache or a clearly new and different headache pattern should be evaluated by a physician promptly and should undergo appropriate neuroimaging. Warning sign 7: Headache following head trauma. A headache that develops following a head injury, regardless of how minor the trauma may have seemed, should always be taken seriously and evaluated medically, particularly when accompanied by certain warning signs. Epidural hematoma, an arterial bleed between the skull and the outer brain covering, is classically characterized by a brief loss of consciousness followed by a lucid interval where the patient appears relatively normal, and then a rapid deterioration in consciousness as the expanding blood clot compresses the brain, a pattern that is immediately life-threatening and requires emergency neurosurgical intervention. Subdural hematomas can be acute, subacute, or chronic and may develop slowly over days to weeks after even seemingly trivial head injuries, particularly in elderly patients, alcoholics, or those taking blood-thinning medications like warfarin or newer anticoagulants. Even concussions, which do not involve structural brain injury visible on CT scan, can cause post-concussive headaches lasting weeks to months, along with cognitive difficulties, mood changes, and sleep disturbances that require appropriate management. Children and older adults are particularly vulnerable to serious intracranial bleeding after head trauma because of differences in brain anatomy and the increased fragility of blood vessels. Any person who experiences headache, confusion, repeated vomiting, seizure, or loss of consciousness following a head injury should be transported to an emergency room for urgent CT brain imaging. Conclusion. Thank you so much for watching our comprehensive guide on the 7 dangerous warning signs of headaches that you should never ignore. Today we covered the thunderclap headache that signals possible brain bleeding, headaches accompanied by neurological symptoms suggesting stroke, the classic meningitis triad of headache with fever and neck stiffness, progressively worsening headaches that may indicate tumors or hematomas, special risks for immunocompromised patients, new headaches in people over 50 including temporal arteritis, and post-traumatic headaches requiring urgent imaging. Remember that while most headaches are benign, knowing these 7 red flags could genuinely save your life or the life of someone you love. If you found this video helpful and informative, please give it a like and subscribe to our channel for more evidence-based medical content delivered in a clear and accessible format. Share this important information with your friends and family, because awareness of these warning signs is truly life-saving knowledge. We look forward to bringing you more essential health content in our next video.